Usually our recommended versions of bariatric vitamins for the sleeve and the gastric bypass are going to be similar in content. They have, we recommend, especially with our gastric bypass patients initially, to take chewable bariatric multivitamins. And we also encourage that they need to have a higher iron supplementation either included in the multivitamin or an additional due to the rerouting of the small intestines. There's that malabsorptive component. So you don't absorb the iron as needed compared to the sleeve where we're not rerouting the small intestines. So we also kind of look at their pre-op labs too to see if they've had a history of iron deficiency prior to, which many females of reproductive age do. We'll already encourage them to be on an iron supplement proactively, as well as like with the vitamin D and so on. But more with the bypass, we're going to have to emphasize the iron more than anything. And as long as they're taking a bariatric multivitamin with that, they tend to get what they need. When we check their labs at the 3-month mark, and we still notice like if their vitamin D is low or something along those lines, they can actually take over-the-counter vitamin D3. That's fine. So we kind of approach that the same way. We do see the difference with the duodenal switch due to there's a fat malabsorptive component of that, where we have to highly emphasize with the fat-soluble vitamins, the vitamin A, D, E, and K. We emphasize the multi-A, D, E, K specifically for duodenal switch because those are usually made in a water-soluble form so that they can receive the nutrient content that they need from those vitamins. Otherwise, we can commonly see the vitamin A deficiencies if they're not on the right vitamins or if they just go by vitamin D over the counter or so on. We have to kind of be more aggressive about that and educate the patient specifically about buying the right vitamins from one of the bariatric companies.